Hello and welcome to Straight Talk. I'm Ayşe Suberkar. The world is grappling with a new surge of infections linked to the Omicron variant. And as some restrictions are reimposed to slow the latest wave, many are concerned about the economic pain that's likely to come. The International Federation of Red Cross and Red Crescent societies have released a new report highlighting the consequences the pandemic has had on inequality and mental health around the world. Hadia Al-Alawi reports.
2 years since the first case of COVID-19 was detected in China. There have been more than 5 million deaths around the world, and the numbers are still growing. But the consequences of the pandemic have also been devastating for people's lives and livelihoods. That's according to a new report by the International Federation of Red Cross and Red Crescent societies. The virus and the restrictions imposed to stop its spread have reduced employment, increased food insecurity, and worsened mental health issues. Wouter lives in the Netherlands and says more lockdowns will only make things worse.
It's so much more than Corona or COVID itself. So people will feel it in their wallet, in their mental health. I can say for myself, for the mental health.
But the Red Cross report found that the pandemic has had more of an impact on some groups than others. Refugees and migrants have been disproportionately affected. Thousands of migrant workers in this dormitory in Singapore say their conditions are dire. Curbs imposed on them have been far stricter than the rest of the population after their cramped dorms have been the center of the country's initial outbreak.
We are facing psychological problems due to the increased pressure from the authorities. We cannot share our problems with anyone.
The pandemic has also hit women particularly hard. The IFRC's research found that 27% of women reported an increase in challenges associated with mental health, compared to 10% of men. Unpaid care burdens and worries about the cost of food and healthcare were the main sources of stress. Lockdowns and the resulting social isolation has also exposed many women to domestic violence. Maria Tablera, who is studying film, says she has been battling severe depression over the last 2 years.
Being locked up, not being able to go out, not being able to have your daily routine makes your mind get depressed, and it only gets worse.
But the effect of the pandemic on the world's mental health is more far-reaching than even that.
We have detected increasing levels of anxiety, anguish, sadness and depression. And if these emotions are not properly addressed, they can become a breeding ground. It will become a complex situation.
And uncertainty about the Omicron variant and vaccine effectiveness has left many countries scrambling to cope. As economists warn, the economic pain may only get worse. Hadia Al-Alawi, TRT World.
And to discuss the socioeconomic impact of COVID-19, I'm joined from Rome by Francesco Rocca. He is the president of the International Federation of Red Cross and Red Crescent Society. Francesco, thank you very much for joining me on Straight Talks. 2 years on since the outbreak of the COVID-19 pandemic, where do we stand now? Are we used to this normal, or are we still trying to get back to our old normal lives?
Thank you for the question. I think that in general terms, we are trying to get back to our normal life, but this is it's like a mission impossible because unfortunately our life has changed, and I don't think that we will have the same normality. We will have a new normality. Maybe we will have occasion to deal again with these kind of viruses in the future. But my hope is that this one is a lesson learned for all the countries, and this is my real hope.
So, how has the discovery of the new variant Omicron and the possible future variants added to the uncertainties engulfing millions of people's lives?
First of all, let me start just about the Omicron one, because when I talked a few seconds ago about the lesson learned, I think Omicron must, and not should, must be the lesson learned for everyone. Because the first lesson that is coming from the Omicron variants is that we have to vaccinate everyone. Yeah. And still we are having this vaccine equity at global level in which many countries, especially the least developed, are paying a price that is really too high in terms of life, but also in terms of the socioeconomic consequences. So the most vulnerable are becoming even more vulnerable.
So are you of the view that the possibility of the emergence of new and deadlier variants get wealthier nations thinking about their assistance to the poorer countries? I mean, what should be done to increase the access to COVID-19 vaccines, and how?
I think there is only one way I think, and this an important responsibility, an important moment will be the WTO meeting, because we have to find solution. Must give access and opportunity to give the technological opportunities to the African continent and to the least developed countries to have access to the licenses, to the patents of the vaccines, the main technological issues. And this is something that now at this point is mandatory, because it's really immoral what is happening in this country. While we are talking in our countries, in the Western countries, about the third dose, someone is also predicting the fourth or the fifth doses, and we have countries on which the vaccination is under the average is under the 10%, or as I talked a few days ago, for example, in Burundi, where I talked with the president of the Red Cross of Burundi, very close to the 0%. This is morally unacceptable.
Yes, true. So how have lockdowns impacted people's mental health?
Oh, in many ways. This is part of the surveys that we conducted through our national societies. The loss of income. There are several factors. It's not one factor, but there are several factors. But mainly the reduction or the loss of income, the isolation, and the loss of sociality is having an important impact on the health, the mental health of the people. And once again, especially for the elderly, for the children, for the women, this is even more heavy. And unfortunately, it's happening again. They are always the most vulnerable when the disaster strikes. And our analysis, our survey proved once again that they are still the most vulnerable, even during this crisis.
Yes, you say the women and children are the most vulnerable ones. But how have the lives of refugees and migrants been impacted since the outbreak of the pandemic?
Many of them, they found stranded in foreign countries and without having access to proper information. So we will try to reduce this gap through the work of our national societies. For example, in Colombia, this is an important part of the work that the Colombia Red Cross did for the Venezuelan migrants now stranded in Colombia, but they were affected because they have less access to the health services. Total isolation and lack of information. So it has an important, and of course, because many of them are also employed in the so-called informal sector or in the black market, they were amongst the first that had a loss of income. And also in Turkey, we have studies that there was a strong loss of income in the Syrian community that living and hosted in Turkey, for example.
Yeah. So how have women been affected? Why are women having more mental health issues than men?
I want to start in saying one thing that I think is more important to be recalled. The women are not only in this situation, but always when a disaster strikes amongst the most affected. Because on them, and this is something that I don't understand still, why there is so many difficulties in understanding something that is so simple to be understood, that they are in most of the cases in many countries the one who are bringing the burden of the families on their own shoulders. They are taking care of the elderly, of the most fragile in the family. They are often, especially in the in the least developed countries, employed in informal sector, as I was saying. So they had an important impact because they had to take care of the sick, because in many countries they intend that is their role, and is wrong, is morally wrong. But we know that this is the reality, to be the ones that take care of the sick, and so on. So this is why they were amongst the most affected, amongst in the areas that we are talking about, especially in the least developed countries.
So, Francesco, how about domestic violence? Has domestic violence risen during this period?
This is something that really struck me. We had a survey, an impressive one, for example, in Salvador, about the 20% of increase, only watching from the period at the beginning of the pandemic, March, April 2020, more than 20% increase the number of cases of domestic violence, but also an increase, and this is very worrying, of the number of teenage pregnancies. And this is again is another signal about the risk to be abused or to be victims of violence at family level. And you know, this is an hidden reality, because it's something that we know, that many women are suffering of domestic violence, but the lockdown and this social isolation exacerbated this exposure of women to the violence.
So what kind of an effect have past lockdowns, social isolation, and online schooling had on young people? How did they manage to deal with that? And are we likely to see a lost generation due to the huge disruptions in the education system across the world?
You see, the school for the children is not only about education, and of course, it's sadly is extremely true what you were saying about the lost generation. But this is also another aspect, because when our children go to school, it's also a school of life. It's the way when they start to socialize, to enjoy the life, to be in touch with the adults world, but also with other children, and they learn a lot about life. So it's not only about education, and this and they are amongst the most affected by the consequences of the lockdown. And then, once again, in that countries, they pay the highest price in terms of education and in terms of having correct relation in the social life.
Okay, Francesco, unfortunately, we'll have to leave it here. Thank you very much for joining me on Straight Talk.